What is the science of connection? Hi, I'm Dr. Ruth the Pain Doc, founder of Chronic Pain Rescue, telehealth practice devoted to helping people who suffer from chronic pain to live pain-free or at least significantly painless lives and to get their lives back, to enjoy their lives again. This topic actually may sound a little off. I'm not going to be referring necessarily to chronic pain, although we would be talking about some other conditions. But understand the physiology of many of our chronic illnesses all start from the same place, all have similar things going on physiologically to result in them, and that would include chronic pain. This topic actually comes from one of the lectures that I had when I learned integrative holistic medicine. In fact, it is by Dr. Mimi Garnieri, who is an integrative cardiologist. She is, I believe, the founder of Scripps College, where integrative holistic, the fellowship is there, and where this branch of medicine is taught. So she definitely knows what she's talking about. So I want to talk about the science of connection. Connection meaning connectedness between people. First of all, integrative holistic medicine is a model of healthcare that embodies interconnection. First, starting off with the relationship between the practitioner, the healthcare practitioner, and the patient. It is focusing on the whole person, and it's informed by evidence. Evidence-based treatments are what are employed, and it's important to view the physical, mental, and spiritual aspects of life as closely interconnected and equally important in approaching treatments. It's not just about a body part. In fact, the focus is on the individual, on an illness. And it's about the fact that we're not just talking about some symptoms that we put a name, a label on it so that we can give you a medication or a procedure, which is kind of how Western medicine has grown to be, but really looking what is the reason for the symptoms so that we can actually address the cause and eliminate or address the causes that contributed to the symptoms. So we know that integration of healing systems is most important. So we embrace a lifetime of learning about all safe and effective options in diagnosis and treatment. These options come from a variety of traditions and are selected in order to best meet the needs of the individual patient. The realm of choices may include lifestyle modification and complementary approaches, as well as conventional drugs or surgery. So holistic medicine, as I said, is relationship-centered care. The individual is key, and we teach by example. I'm working on my own health issues and incorporating lifestyle medicine in my own health and my own life as I help others to do the same. We also recognize that the healing power of the body is innate. If you cut your finger, you don't have to tell your finger to heal. It knows how to heal. It does that. So we really just want to observe the natural healing powers of the body and optimize them. And if there are factors that are preventing the body from healing, there's something abnormal going on, that we try to address that to help the body to get to where it can self-heal. And we embrace the healing power of love. Love heals, and it is the most powerful healing force there is. So just looking at some studies of the physiology of connection, this is a research review. Just found it really interesting, and perhaps it's things that we take for granted. We think that's probably true, but to just look at the evidence from research and how profound it is really is something to take into account, the importance of relationships. So connections with parents. In the context of studying the personality traits and relationships that contribute to a physician's health and well-being, 126 male Harvard students were asked questions regarding anxiety and related mental health issues. Included were questions about their relationships with their mother and father. They were then followed for 35 years regarding their own development of health risks and illnesses. One of the key predictive questions was the following: would you describe your relationship with your mother and with your father as very close, warm, and friendly, tolerant, or strained and cold? Follow-up 35 years later, the outcomes were as follows. If relationship with mother was tolerant or strained, 91% had significant health issues. If the relationship with mother was warm and close, 45% had significant health issues. If relationship with father was tolerant or strained, 82% had significant health issues. If relationship with father was warm and close, 50% had significant health issues. If relationship with both parents was strained, 100% incidence of significant health issues. If relationship with both parents was warm and close, 47% had a significant health issue. Another similar study, 1,100 male medical students, also at Harvard, were surveyed using a closeness to parents scale. Follow-up occurred 50 years later. The degree of closeness to parents strongly correlated with cancer rates, suicide rates, coronary artery disease rates, hospitalization for mental illness, and interpersonal difficulties. These findings were independent of smoking, alcohol use, or radiation exposure. The correlation was strongest for the development of cancer. These two studies strongly suggest a relationship between the connection of parent to child and the subsequent health of that child as an adult. There have been other such studies, but these two are the most complete and most representative. It is also important that these studies looked at and accounted for other disease risk factors, and the results were independent of these risk factors. Let's talk about the connection in marriage. Again, probably sounds obvious, right? But I just think it's really fascinating to look at it. 10,000 men were surveyed and followed for 5 years. The key outcome was the development of angina or chest pain. Men with substantial risk factors for coronary artery disease, such as elevated cholesterol, age over 45, hypertension, diabetes, EKG abnormalities, were 20 times more likely to develop chest pain than men without these risk factors. When asked, does your wife show you her love? Men within the high-risk group who said yes, their wife showed them love, had half the rate of angina or half the rate of chest pain as those who answered no. This study indicates that men who perceive themselves to be loved gain comfort in that fact. These men probably have lower catecholamine and cortisol levels, lower stress hormones, and are likely to benefit from this perception. In a similar study, men who are shown love by their wives have fewer gastric ulcers. Another study, nearly 1,400 men and women who underwent cardiac catheterization were found to have coronary artery disease, were followed for 5 years. So they had a cardiac cath, were found to have coronary artery disease. Social issues were monitored. Two key questions were, 1, are you married? And 2, do you have someone in whom you can confide? After 5 years, roughly 15% of those who were married or had a confidant were dead, while 50%, 50, of those patients who were unmarried and had no confidant were dead. These two studies are good examples of the power of marital relationships. Now, telomere length, the telomere is a part of the chromosome, and they use it in terms of studying age, the process of aging. Telomere length has been used to assess biological aging and is associated with various physiological, psychological, and social factors. Yen and colleagues evaluated the effects of income and marriage on the length of telomeres in older adults. Telomere length was negatively associated with lower income and positively associated with marital status. This association persisted after controlling for gender, age, educational level, physical diseases, including diabetes, hypertension, cardiovascular disease, cerebrovascular disease, and Parkinson's disease, depression, perceived social support, and security. Authors concluded that marriage and higher income have a protective effect against aging. All of these studies point to one factor, that a happy marriage and companionship are good for your health, independent of other risk factors. Sounds like no duh, right? Sounds like a no-brainer. But I still think it should be emphasized, because so much of our lives we're neglecting relationships and neglecting that aspect of our health. What about lack of a connection or social isolation? Being well integrated socially reduces all-cause age-adjusted mortality by a factor of 2-fold, about as much as having low or versus high serum cholesterol levels or being a non-smoker. Let me just say that again. Being well integrated socially reduces all-cause age-adjusted mortality, all-cause age-adjusted risk for death by a factor of 2, about as much as the difference between having low versus high serum cholesterol or being a non-smoker compared to being a smoker. Depression is linked with multiple diseases such as cancer, sudden death, and coronary artery disease. Nancy Fraser Smith in multiple studies demonstrated that social support ameliorates the this effect in heart patients. Social support does not necessarily eliminate the depression, but it does eliminate the adverse health outcomes of the depression. Now, another study where family and friends questioned 149 men and women who were going to undergo cardiac catheterization as to the extent they felt loved and supported. The higher the degree of love and support, the lower the number of blockages found on the subsequent angiogram that was done, and it correlated positively with the degree of love and support. In a study of social contact and mortality, death in the elderly, 6,900 participants were surveyed and followed for 17 years. Key issues were contact with friends and relatives, church membership in clubs or groups, and marriage. Those without close ties or frequent social contact had an overall death rate 3.1 times higher than those who did have these contacts. Both men and women in the low connection category had higher cancer death rates. An analysis was done in breast cancer patients found that those with low connection had twice the death rate, regardless of race, black or white. Social ties may even affect susceptibility to the common cold. So nasal drops containing 1 to 2 rhinoviruses were given to 276 healthy volunteers until the participants shed virus. The individuals were questioned on 12 types of relationships, such as parents, children, friends. Each positive relationship was scored as 1 point. Participants with less than 3 points developed cold symptoms at a rate 4 times greater than those with higher scores. Now, this is the study that I remember way back when I first took this course, because it stood out for me. There was 3 towns in Pennsylvania studied over a 50-year period. They were Roseto, Bangor, and Nazareth. So in the 1930s and 40s, it was noted that Roseto has a significantly lower rate of acute heart attacks than its neighboring communities, despite equal prevalence of diabetes, obesity, and high-fat diets in the 3 towns. During the follow-up in the 1970s, the rate of heart attacks and overall mortality substantially increased in Roseto, but not the other towns. When health behaviors were analyzed, there were still no significant differences in the 3 communities with regard to smoking, weight, diet, diabetes, or other risk factors. What had changed, however, was the social structure of Roseto. Roseto had been populated by descendants from southern Italy in the late 1800s. In the 1930s and 40s, it still had a much greater number of 3-generational households, church-going, and households with close family ties. As these ties began to disintegrate in the late 1960s, the rate of heart attack and death began to rise. So Roseto is the longest of the multiple studies of communities showing a clear relationship between community activity, social structure, and the rates of disease. It also points toward the role of religious practice and its effect on disease prevalence. That's pretty much what I want to share today. I know it's indirectly talking about chronic pain. In fact, I didn't talk about chronic pain, but I did talk about social connection, because a lot of times, and you know this better than me, people with chronic pain do get isolated and do get lonely, and it needs to be addressed. And I'm hoping that we can do things here online that can at least put a little puncture into that bubble and create a community of support. We will be having a cooking class online on Saturday, April 15th from 10 a.m. to 12 noon Pacific Standard Time. I do hope if you consider signing up. You may not even be somebody that thinks of yourself as a chef or cook, but I can tell you it is fun. Chef David is just a wonderful instructor. He has anecdotal stories and gives a little cultural background to his home of Tuscany. You know, I gave this to my son, my oldest son, for his birthday this past summer, and he said, yeah, it was more fun than I expected it to be. So I am inviting, if you want to join us for that. If you have any topics that you'd like me to discuss, or you have questions about, feel free to message me at Chronic Pain Rescue. I'd be glad to answer any questions. If you want to work with me, or you're thinking you'd like me to address your specific issues, I do have free consultations for the phone. Whatever help I can be, I'm here for you. Until next time, peace and blessings.